If you want to get healthier, you should not overlook protecting and maintaining the health of your lungs. According to the World Health Organization, chronic obstructive pulmonary disease, which is a disease that affects your lungs, it's the third leading cause of death worldwide, causing 3.23 million deaths in 2019. The World Health Organization also said, there is no cure for chronic obstructive pulmonary disease. However, earlier diagnosis and treatment are important to slow the progression of symptoms and reduce the risk of flare-ups. In this video, we are going to talk about what is chronic obstructive pulmonary disease, what are the symptoms, what causes and measures to maintain and prevent lungs infections, as well as some food to eat to help you maintain healthy lungs. Chronic obstructive pulmonary disease, or COPD, is sometimes called emphysema or chronic bronchitis. Emphysema usually refers to the destruction of the timing and sacs at the end of the airways in the lungs, whilst chronic bronchitis refers to chronic cough with the production of phlegm resulting from the inflammation in the airways in your lungs. They are preventable and treatable chronic health conditions. However, with asthma, you should know that COPD is not asthma and asthma is not COPD. Although they all affect the lungs and may have the same symptoms, they are different. The World Health Organization estimates that about 325 million people worldwide are currently suffering from asthma. If you are among, you can benefit from this video as well. The symptoms of COPD include breathlessness or difficulty in breathing, chronic coughing, usually with phlegm, tiredness, chest discomfort. Even if you don't show these symptoms, you should continue watching this video so you know how to prevent your lungs from infection. Of course, one way to avoid lung infections is to quit smoking. According to the Centers for Disease Prevention and Control, more than 10 times as many US citizens have died prematurely from cigarette smoking than have died in all wars fought by the US during its history. In short, smoking is killing people more than guns. Smoking does not only increase your risk of lung cancer, but also COPD and even asthma. Every time you smoke a single cigarette, you inhale thousands of chemicals into your lungs, including nicotine and carbon monoxide. And these chemicals do nothing to your lungs except damage them, which makes it difficult for your lungs to clean themselves and give you a healthy life. And don't be misinformed by their flavors and type. Hookah or shisha, or e-cigarettes, are not any less harmful than tobacco. The good thing is, according to the American Lung Association, the first 2 weeks after quitting, your risks of having a heart attack begin to drop and your lung function begins to improve. There will be a link in the description below so you can know how your body progresses beautifully after quitting cigarettes or tobacco use. Another way to avoid lungs infections is to reduce your exposure to air pollutants. Your lungs can easily resist toxics from the air when you are young and strong. However, as you age, they begin to lose this ability. So try as much as possible to reduce your exposure to air pollutant. You can do this by: while you don't smoke or have avoided smoking, you should not sit around smokers or secondhand smoke, you will inhale the same toxics. Avoid exercising or moving around heavy traffic so that you do not inhale the exhaust from the vehicles or cover your nose and mouth when you're in heavy traffic. Avoid going outside during peak air pollutant times. If your workplace produces air pollutants, be sure to take all possible safety precautions. Jobs like construction, waste management, and mining can increase your exposure to airborne pollutants. Do you know what is more dangerous than outdoor pollutants? The indoor pollutants. Here are some tips for decreasing indoor airborne pollutants. You can reduce your indoor pollutants by opening your windows frequently to increase ventilations and storing ventilation devices like fans and others. You can also do this by keeping your home clean as possible. Dusting the furniture and vacuuming at least once a week can help you reduce your house airborne pollutants. And also, try as much as possible to make your home a smoke-free zone. Other measures will be shared in the description box below. Practice deep breathing exercises regularly. The American Lung Association agrees that breathing exercises can make your lungs more efficient. To do this, sit somewhere quietly, slowly breathe in and out through your nose, and try wearing comfortable clothes too. Here is a timer to help you with how you can do it. Ready? Try to close your eyes and do it for 10 to 20 minutes. This exercise makes you feel less stressed and more relaxed. Try to do it at the same time once or twice a day. Do aerobic exercise regularly. Exercising regularly is one of the most important things to do for your lungs and your overall health. When you exercise, your heart beats faster and your lungs work harder, which steps up the lungs' activities to deliver more oxygen while expelling more carbon dioxide from your body. That is why it is important to regularly do aerobic exercises that make you breathe harder. Even if you develop lung disease down the road, exercise helps to slow the progression and keeps you active longer. Take preventive measures for your lungs. You can do this by staying up to date on any vaccinations provided to prevent lung infections, like COVID vaccines. Wash your hands regularly with soap under running water. Cover your nose and mouth when coughing and sneezing to avoid spreading lung diseases like tuberculosis. Moreover, you have to eat more fruit and vegetables that will help you boost your immune system and also good for your lungs. These foods include beetroot and its greens, turmeric, peppers, red cabbage, blueberry, tomatoes, green tea, apple, yogurt, coffee, cocoa and its products, olive oil, oyster, anchovies. Visit your doctor anytime you are feeling discomfort in your chest or showing any lung infection symptoms. May you get the most out of your life by applying the measures discussed earlier. Thanks for watching.